So we are very happy to have all of you here today for what is the second webinar in a two-part discussion on Indian menstrual markets. The webinar is titled A Market Development Lens to Menstrual Health, Integrated Health Services. And RHSC is incredibly excited to be hosting this webinar with our colleagues at Menstrual Health for Action, or MHAI. And we are looking forward to what promises to be a very engaging discussion today. For those of you who don't know me, I'm Sarah Webb. I'm a Senior Technical Officer at the Reproductive Health Supplies Coalition, where I play a couple of different roles, but one of them is the incredible honor of supporting and leading our menstrual health supplies work. We wanted to give everybody, before we start, just a quick background on this webinar series that we are co-hosting with another RHSC workstream this year. So this joint learning series on market-based approaches for menstrual health is being co-hosted by our Market Development Approaches Working Group and our Menstrual Health Supplies Workstream. And the purpose of this learning series is really aimed at supporting the dissemination of relevant data, evidence, key resources, and case studies of market-based approaches for menstrual health. This conversation originated at our general membership meeting in Accra last October, and it has been a very exciting series to put together with a variety of different partners around the world. If you did miss earlier versions or earlier parts of the webinar series, you can access all of those on RHSC's website. The link is displayed on the screen, but it's just under our Activities tab and then under Webinars. Before we get started today, we also wanted to give a little bit of context of why we're having this conversation and sort of where the interest in market-based approaches for menstrual health came from. And to do that, we wanted to give a little bit of a sense of what we mean by market-based approaches. And so when we're talking about the menstrual health market, we're talking about a market that connects the demand for and the need to manage menstrual health to a supply of products and services intended to meet that need. So making sure that people around the world that are menstruating who have a demand and need for menstrual products, as well as services and information, are able to access those. The goal of this is to have a well-functioning menstrual health market that delivers equitable and sustainable access to a wide range of quality and affordable products and services to the widest possible group of those who menstruate when and where they need them. And so our goal is to not only make sure that people have the products that they need, that's certainly part of it, but it's also to make sure that those products are affordable, that they're of good quality, and that they are delivered in a way that meets the needs of menstruators, regardless of where they are and what their preferences might be. And so finally, market-based approaches to menstrual health are interventions that use the interplay of supply and demand to support market actors to create a well-functioning competitive environment. Or competitive market. And so the goal is to really leverage market dynamics in a way that accelerates access to menstrual health and creates opportunities to reduce price while maintaining quality and supporting innovation. And so it is my honor today to introduce you to our two speakers who are going to be supporting our opening remarks. We have Arundhati, who is a public health professional who works at the intersection of health programs, research, and policy advocacy. She is a passionate advocate of menstrual health and works globally and in India to build and strengthen the menstrual health ecosystem through knowledge sharing, evidence generation, and policy advocacy. Arundhati is the co-founder of MHAI, our co-host of today's meeting, an initiative that empowers the ecosystem to use the menstrual health lens to improve girls' and women's health and well-being. I'm also excited to introduce you to Lucy, an independent consultant in sexual and reproductive health and rights. She is based in North Carolina and is a very active member in the RHSC Menstrual Health Supplies Workstream. With that, I will hand it over to you, Arundhati and Lucy.
Thanks, Sarah. And again, a very warm welcome to everyone who's joined us today for this exciting webinar. So Lucy, before we get started, I wanted to share this slide with the audience and also with the rest of our speakers. We saw a very critical development that took place a couple of years ago, 2021, in fact, that looked at kind of transitioning our focus thus far on menstrual hygiene management, which has spurred action so far on this particular issue to menstrual health. And this is particularly significant given the context of our webinar today. Now, I'm not going to go through this definition, and we're going to keep it up for you for a minute or so. But what I want to draw your attention to is that the conceptualization as menstrual health is key because it looks at this issue from a health and well-being perspective. And that's really critical when we're looking at the market lens for menstrual health products and services. We also want to draw your attention to a few other things that this conceptualization comes for. One is that the expansion of this issue to looking at it across the life course and not just on adolescents, and also various aspects of menstrual health. So the bullet points you see and the underlined sections are various points at which we think menstrual health intersects with healthcare services for health promotion, for disease prevention, as well as for diagnosis and treatment for any conditions if they do arise, as well as with important aspects related to menstrual health. For us, this conceptualization provides us a direction to look at menstrual health more holistically, which includes hygiene, but goes well beyond it. And it provides us with important opportunities for us to build and strengthen healthcare to meet menstrual health needs across the life course. So with this, I want to turn to Lucy. So Lucy, we're really happy that you've joined us today to discuss this. Now, you've been looking at menstrual health, but you've also been looking at how it fits in within other important health issues for women, specifically reproductive sexual health and rights. So Lucy, we want you to kind of start off by giving us a bit of a big picture idea of how menstrual health and reproductive sexual health and rights are connected. So if you can share your thoughts on that, this will help us kind of build the foundation for the webinar and the discussion.
Thank you, Arundhati, and thanks for having me as part of this webinar. I love how it's broadening the lens that we use to think about menstrual health and hygiene in multiple different ways. And I'm really looking forward to hearing the panelists later talk about their innovative work. As far as those big picture connections between menstrual health and the broader field of sexual and reproductive health and rights, and really the general health of half of the world's population, there are several areas. First, the menstrual cycle is a biological process that is all about reproduction. Menstruation is the biological indicator that pregnancy has not occurred. The egg that was released from the ovary was not successfully implanted in the uterus, and the lining is being shed. That's the process. Second, the menstrual health interventions should target the same populations targeted by reproductive health programs, including adolescent and child health and maternal health programs. And specifically, this means girls, women, and others with the uterus from puberty or just before through menopause. And finally, I think that there are a lot of shared values and goals between menstrual health and reproductive health and rights, including the value of dignity, gender equality, health, well-being, human rights, enabling self-care, and of course, access to education, employment, and other opportunities. So I think these are the big reasons for us to really be thinking about menstrual health more holistically, including integration into broader health systems.
Thanks, Lucy, and thanks for bringing that connection that there's a strong biological linkage, but there's also a strong sociocultural linkage as well when we're looking at this. So taking off from that, we see menstrual health as an important opportunity to address girls' and women's needs across their life course. And we also know that sexual and reproductive health issues also exist across the life course. So where do you see these critical intersections where we can begin to think about integrating menstrual health into ongoing actions for reproductive and sexual health issues across the life course?
Yeah, as you said, there are some of these touch points that are biological and some that are social cultural. In working through the life course framework, I'll start with education. And in the prepubescent years, it is important for children to start learning about their bodies, how they function, and the changes that they can expect during puberty. They also need to learn about adult bodies and reproduction. And comprehensive sexuality education programs at age-appropriate levels should include this wide range of information about sexual and reproductive health topics, including menstrual health. Because when women and girls come of age with that clear understanding of their bodies, it can reduce taboo and stigma and help them lead healthier lives. And if this education isn't provided during childhood, I think it's still very much needed for adults. Many of us, myself included, may relate to receiving inadequate education about our bodies as a child. Early adolescence during that puberty transition and menarche is recognized as an important time to address gender norms. And programs may want to think about what local norms are helpful and should be uplifted and what norms are harmful and perhaps could be shifted. Another touch point is around fertility and contraception, because in the reproductive years, when individuals are actively menstruating, they may be either trying to conceive or trying to avoid a pregnancy. And knowledge of the menstrual cycle can help with both goals. Contraceptive methods, particularly hormonal methods, and the copper IUD may also influence the menstrual cycle through side effects, though some of these may also be considered side benefits. And we call these changes contraceptive-induced menstrual changes. And they include things like changes in the bleeding pattern, in pain, and other symptoms. Contraception may also help alleviate menstrual disorders, which are really quite prevalent, but unfortunately underdiagnosed. And periods may be very heavy or painful or irregular. And these can be signs of things like endometriosis, uterine fibroids, polycystic ovarian syndrome, and several others. And so while it's normal for most people to experience some discomfort with menstruation, if you're experiencing pain, bleeding, or other symptoms that disrupt daily activities, it's worth getting checked out by a physician because there may be treatments. And our menstrual cycles may be telling us more about our health than we realize. Abnormal uterine bleeding, which means bleeding outside of your normal cycle throughout the month, or unusually heavy or light periods, may be a sign of one of those menstrual disorders, or a sign of a bleeding disorder, a sexually transmitted infection, or cancer in the reproductive organs. And a lack of bleeding may be a sign of something like malnutrition or an eating disorder. In addition, a couple of other things I'll touch on just briefly. Inadequate menstrual hygiene may result in urogenital tract infections, and a general lack of access to appropriate menstrual health services can cause our mental health to suffer. And going back to that life course, perimenopause and menopause are grossly neglected, despite being both part and parcel of menstrual health and influential on so many aspects of our health and well-being. Like puberty, it's a time of great change in our bodies, and so there's many health repercussions. So I expect our esteemed panelists will talk more about some of these connections and maybe even bring up others too. So back to you, Arundhati.
Thanks so much, Lucy, for this great overview. And yes, I think that what our panelists are going to do is kind of bring these interconnections to life through the kinds of interventions that they're running for girls and women in India and outside. So, Sarah, I'm going to request you to bring the slide deck back up. And just very quickly to reiterate some of the points that Lucy has shared and to bring some context to India. Sarah, if you could just press the next slide. And again, please. So, Lucy, you've kind of highlighted where we need to be looking at these intersectionalities, where the opportunities are from menarche to menopause. And I also want to emphasize, and you touched upon this, that we may need to be looking slightly earlier to late childhood, because we do see some concerns around early menarche in some area, that is starting your period before you're 10. Just another click, please, Sarah. So let's put this in context to where we are in India. And so this data that you're seeing on the upper part of the slide is taken from the National Family Health Survey, the last round that was done 2019 to 2021. And we see that while the average age of menarche in India is 13.5 years, there's some studies and some anecdotal evidence that has set off some alarm bells that girls hitting puberty at a much younger age. So they're hitting puberty at 8, 9, 10 years of age. And while they may not follow the bulk of the population, it's something that we certainly need to keep an eye on and understand what's driving those changes. And this is important. The other thing, Lucy, that you highlighted was anemia. And that we're seeing that in a country like India, where child anemia amongst adolescent girls and also amongst women of reproductive age is quite high. And that's also an issue for us to be looking into, and what that means for menstrual health and the menstrual cycle. When we move over into the reproductive age group, we've got some data that shows that while hormonal contraceptive use in India is still low, hormonal contraceptive and long-acting contraceptives are being promoted as a way to support healthy timing and spacing of pregnancies in the country. So again, while currently the use of hormonal contraceptives may be low, we can anticipate that this might grow a little bit in the future. And again, we need to be prepared for what that means in terms of changes to the menstrual cycle and supporting adherence to these methods. Now, Lucy, again, you've pointed out two important menstrual disorders. Now, in India, the evidence suggests that polycystic ovarian syndrome ranges between 3.7 to over 22%. And that's pretty significant. Endometriosis, as per FOGSI, which is like our Federation of Gynecologists and Obstetricians, places the prevalence at approximately 10%. Again, a staggering number for a country of our size. Cervical cancer, many of you would know that India is one of the leading countries with cervical cancer prevalence, and we also have some of the highest deaths due to cervical cancer. Our screening, however, is extremely low, but there are efforts to emphasize screening and early detection. And again, this is important for us to keep in mind the links to menstrual health. Lastly, I want to call out this has been reported in the news of late of unnecessary hysterectomies and what this means for women. And strikingly, data from the National Survey shows that the average age or the median age for hysterectomy in India is under 35 years. And that's really striking because when you remove these organs, it's going to have pretty significant effects on women's and their quality of life, and also the implications for other aspects of their health beyond reproductive and sexual health. We also see that the age at menopause is quite low in India, especially for low-income groups and those with lower levels of education. It's in the early 40s. So again, something for us to look at. Can you just press another click, please, Sarah? So what does this mean for us? Now, this middle band, hope you can see it clearly, looks at the public health programs or government-led programs. And we've seen that across the life course, we've got some really important programs, right? From child health and nutrition, adolescent, SRH, as well as nutrition programs. We've got a bunch of interventions from contraceptive use to safe abortion care, to looking at screening and early detection for cervical cancer across the reproductive age group. We've also got a policy that's looking at mental health. And lastly, when we're moving towards a menopausal age, we do have huge efforts that are looking at screening, diagnosis, and treatment of non-communicable and chronic diseases. Now, all of this is really critical and offers us critical windows of opportunities to look at menstrual health, while menstrual health may not be specifically called out in any of these policies or programs as yet under the public programs of the Government of India. But we certainly have opportunities. But what does this mean when we're talking about a market lens for menstrual health? So Sarah, if you can go to the next slide. So drawing upon what Sarah shared about the market lens, we've taken this actually from work that the RHSC group is already doing. And here we're looking at the market lens where we've got your consumer, your user, your patient, your client right at the center. And you have a set of demand side and supply side factors that are supporting their access to healthcare. So supply side factors are anyone from your healthcare providers, your frontline healthcare providers, and can even include pharmaceutical companies and chemists, as well as health insurance providers. And your demand side actors are those that are sparking demand for these products and services. And that can also include anyone from your healthcare providers, frontline workers, to the media that's kind of sparking the desire to seek healthcare and health products. If you can click twice, Sarah. Now, what does this mean when we're looking at the private sector and public sector? Now, India is a pluralistic health system. So we have a strong, vibrant public sector, but we also have a really strong and vibrant private sector. And when we're looking at sexual and reproductive health and menstrual health, what we're seeing is that they both may play distinct roles while they have some overlapping roles in the kinds of services that they both provide. So both the private sector and the public sector have played an important role in providing information on periods and on providing period products. But we also see some distinct opportunities in both. For example, the public sector is a huge provisioner of contraceptive access, especially for low and middle income groups, for institutional deliveries, for menstrual products, and with the new HPV vaccine policy coming out in the country, they're going to be a significant provider for that. When we look at the private sector, they may be plugging some pretty significant gaps that we have in healthcare, including treatment or diagnosis and treatment for RTIs, hysterectomy, menstrual concerns and disorders, menopause care, health tech and femtech, and even mental health. But what we're noticing in this is that if we're going to reach, as Sarah said, if we want to reach as many people as we can, reach them wide and provide them with the quality services that really meet their needs where they need it, we're going to have to leverage the strengths and the benefits of the private sector and the public sector, including both of them together through public-private partnerships to be able to ensure menstrual health for all. And so when we're looking at the market lens for menstrual health care, we want to be looking at it in these ways. Now, with that, I want to open up to our very exciting panel discussion. So I'm going to bring up, we're going to bring up our panelists for today. So Sarah, if you can go to the next slide. And I'm going to do a quick intro to our panelists. Again, if you have any questions for us, please let us know in the chat box. Okay, so we've got with us Dr. Abhijit Pathak from Jhpiego. Abhijit has 20 years of public health experience in India and Southeast Asia. And before joining Jhpiego in his current role, he was with the Bill and Melinda Gates Foundation, managing their family planning investments of the India country office. He's got deep technical knowledge for family planning and has been assisting, providing technical assistance to the government of India at the national and state level in many states. Next, we've got Ben Bellows, who is a co-founder and chief business officer at Nivi. That's a market-shaping digital health company, empowering consumers with targeted health information, products, and services. Before Nivi, Ben served as a health researcher at the Population Council for 12 years, evaluating the role of targeted demand subsidies to boost access and quality to reproductive and maternal health services. That consumer focus carries forward in the work that he's doing in Nivi. We're also really delighted to be joined by Swati Kulkarni, who's got 20 years of experience building products, technologies, and businesses. And over the last 8 years, she has been specifically focused on building women's health services and products through businesses. Swati is an ISP and BITS alum. We've also joined by Navneet Kaur, who is the founder and CEO of Femtech India, a fantastic new company in the country. It's a leading platform that's seeking to revolutionize the femtech sector in India and globally as well. Through Femtech India, Navneet offers comprehensive services to femtech founders and offers a range of services and networking opportunities. And lastly, but not the least, we're going to welcome back Sarah Webb from RHSC. Sarah is the Senior Technical Officer at the Reproductive Health Supplies Coalition, where she provides technical leadership to the coalition's work in advocacy and the diversification of financing as well as menstrual health. Sarah has over 10 years of global sexual and reproductive health experiences, particularly around the intersection of SRHR and market development. So we are delighted to have all 5 of you with us during this panel discussion today. Now, we've got 3 questions for our panelists, and we're going to start with the first one and dive in. So to each of you, our question is, what is the opportunity that you see for menstrual health services? And do you see these opportunities for integrating menstrual health within existing health services, as well as within existing sexual and reproductive health services, or emerging reproductive and sexual health services? So Abhijit, I'm going to start with you. So over to you.
Hi, thanks. I hope you can hear me all right.
Yes.
So absolutely, I think first of all, I love the context setting and in the earlier session that just happened, because it really laid out for all of us, the gaps and the opportunities in this sector. I represent Jhpiego and a large USAID supported program that I run, which has a boutique of, has a bouquet of investments, about 14 or 15 investments ranging from public sector to private sector, from entrepreneurship to the school health program. And we've been very fortunate that the donor has sort of concurred with our intentional attempts of, integrating menstrual hygiene in all of these. And from that experience, I think 2 or 3 things that I can, sort of highlight here in this forum is that some of the traditional ways still exist. The traditional way is to use menstrual hygiene as an entry point. Whenever we're talking about, so entry point, it still continues to be the most effective, the most politically acceptable, the most acceptable for young, unmarried, adolescent and pre-adolescent populations, because there, whether it's parents, whether it's schools, whether it is policy audiences, it's always a difficulty to go into talking about contraception or sexuality education or gender identity or any of these. But menstrual hygiene continues to be the entry point which allows us to gain entry into these places and start a confidential conversation with youngsters. Once that starts, then you can take that conversation to other places. And so that has been the traditional point of integration of menstrual hygiene and SRH, and it still is one of the best. The second thing that has now emerged for us is this whole market-based interest in these products. And so the product lens is the second lens that I want to highlight, because, in our Yash Entrepreneurs, when we started out trying to create in the Indian startup economy ecosystem, a new genre of startups called SRH startups. Because whenever these SRH startups used to compete, they would compete with the giants like 1mg and Farmeasy, and they were a different category. And so we were successful. But out of the 12 startups that we currently support, 4 of them are in the menstrual hygiene space. And the reason is the attractiveness and the revenue generating capability that this market, that the startup founders are identifying in these markets. So whether it's a circular economy of menstrual hygiene products like pad care, whether it's an innovation in the products such as the Bliss pads, which are an edible fiber made pads, biodegradable, FDA registered, and so on, or whether it is just innovation in the products such as newer design menstrual cups, etc. And so there's a large market that's come up. Airports now have vending machines. We are getting, outreach from other countries. A few days ago, Bangladesh government reached out to 2 of our startup founders to say they are coming up with a policy and how can these startups help them. And so there's this whole India for the world thing also happening very slowly and subtly with these innovations that are happening. So that's the second lens of the product part. And the third, of course, is the closing of the loop part. So many a times we have had post our services difficulty in following up with clients, and we are now realizing that at the end of the service chain, if we can offer menstrual hygiene products, consultation services as a means of getting the, let's say, the post-pregnancy mother back into the system, or to get a post-abortion client back to that pharmacy from where she got the MA pack, all of these are great sort of closing the loop points for us. So maybe at the beginning, these 3. Over.
Thanks, Abhijit. I like the way the entry point, what's the innovation gap that we're filling, as well as closing the loop. The great points. Next, we're going to go to Navneet as, again, another ecosystem enabler. Navneet, your thoughts on what's the opportunity for menstrual health and health services integration in India? Navneet, can you hear us?
Hi, am I audible?
Yes, we can hear you now.
Okay, perfect. Thank you so much for having me. I think this is such an important conversation. As we're seeing that landscape is evolving, which is femtech, very new category, finally getting spotlight. And also, if we look at the landscape, actually it started from menstrual hygiene only, right? So if we look at the data points that 15 million women in India suffer from reproductive health problems, and the femtech market is growing at 1.3 billion by 2030. So if we look at menstrual landscape, that has a huge contribution, or around 35%. So when I see the opportunities, and I will also talk about, the few gaps as well of opportunities, of course, India being a consumer space, that products has always been spotlighted in this category, right? So which is startups are creating very innovative products and services. As we look at menstrual cups, or maybe more sustainable products, which are again eco-friendly and good for environment as well, right? But also predominantly that the menstrual cups, it didn't really do well because the market share, we've recently done our report, which would be out very soon, that only it's 5.7% of the market share in India. And also additionally, when I look at it like opportunities, were we also seeing that the technology element, right? Just not just looking at the product landscape, but deeper down that menstrual health problems, as we just highlighted earlier, that which is associated to mental health, right? There are also now products, they are actually the startups are building in, which is period tracking, which giving in-depth information about your health. Also the algorithm just telling you that, what are the hormonal changes, how that can affect your mental health, PMS, brain fog, unhealthy eating habits, which are happening because of lifestyle diseases like PCOS is just so much on rise in India, right? And that all these things are leading into loss of productivity for women, because women are feeling quite challenging, your day-to-day life because of lifestyle diseases. So I think opportunities lies within those areas, because I would highlight, as I said, products is one thing which we are seeing there's a huge potential and the growth, but what needs to be built on the deeper down problems of which women are facing, even dysmenorrhea, right? Like it's such a big problem in India, and we only have one company addressing that. So I think there is a space for innovation for that as well. Again, highlighting the great work what femtech companies are doing. They are not just building the products, they're also creating education awareness so they can address this menstrual health gaps beyond just the product landscape.
Thanks, Navneet. That's great to hear from you on this. And I think it's an interesting point that you brought up, that we've had a product or a period product focused femtech landscape, and we're trying to shift that to address some of these other issues. And that's actually a great segue to both Ben and Swati. So Ben, over to you first for your opening remarks.
Great. Everybody, thank you. It's wonderful to join you all on the panel and join you all here on the webinar. Just a few thoughts as we kick off this part of the panel. And thinking about opportunity, there's really a surplus of opportunity here. There's opportunity certainly with integrating on other health services, existing reproductive, even maternal health services, thinking about where those touch points are. But I think Navneet's comments as well right there at the end about education are critical to think about upstream. What does it mean to integrate into education? How is education a product? And if you begin to develop workflows, reproducible workflows, certainly in the tech space, you see this a lot, you're productizing a particular series of activities or steps. And productizing education itself, I think, is where integrating menstrual health into other educational streams or other health journeys can be incredibly transformative. And this is, I think, an important part of the market to consider if we're really to see the market develop consumers as much as producers and suppliers and distributors. There is a supply side available. It serves a certain segment now of consumer, but there's a big part of that market now that effectively functions or exists with a segment of non-consumers, people who would if they could, but can't, so they don't use menstrual health products. So this product market fit is really where I see the innovation or the opportunity, if you will, going forward. This opportunity of helping non-consumers become productive, choice and rights-based driven consumers in this menstrual health space. The opportunity here then is, before we're even talking about transacting or the purchase or accessing products or services, what does it mean to be able to access educational products, to be able to use awareness as a product in its own right to reach and convert effectively a segment of the market that can't otherwise access available products now? To get product market fit, we need to know how these components ideally do fit together. What are consumers doing now who can act on the menstrual health space? And then what are consumers not doing? And if we can understand those insights into those barriers in the menstrual health space, I think we'd be well positioned for the opportunities ahead. So I'll just pause there.
Thanks, Ben. I like this product market fit, and I hope you can, when we ask the next question, that you can expand on how you're doing this to maybe and bring that to life for us. Thanks. Swati, over to you. I'd like to hear your comments.
Yeah, I mean, thanks to the panelists, they've already set the stage for what I'm going to say. I'd quote my dad here. He's a very senior gynecologist, now retired. He would say, a woman is a woman from the womb to the tomb. And it's very true. So menstrual hygiene can actually not be separated from anything that we do in this world. I think Lucy had mentioned about, menstruation being a part of the entire ecosystem. And Sarah, you also mentioned about how this entire thing about education is significant, right? And we've all touched upon this. So a couple of points here. First, the pyramid, the Maslow's hierarchy, if I have to sort of bring it to the health hierarchy, the first thing is to be aware, and both Navneet and Ben have spoken about this. But awareness is not just restricted to the person who's going through this. It's the entire family or the community that needs to get built into it. So the digital transformation that Ben was talking about, how do you actually create content that can disrupt like billions of people, in terms of their thought process? So I would say that if we want to integrate the entire menstrual hygiene, education, implementation, or execution with the existing systems, we need to hack that space of how do we educate people, not in hundreds and thousands, but in millions and billions. I think that would be point number one. Second is sensitizing and not, feeling alone. We run a company called Elda Health, which is focused on menopause. And when we first started it, women didn't know that there were millions of people in the country today who are going through this problem. So they felt singled out. So how do you actually remove some of these taboos? We've spoken about PCOS, we've spoken about dysmenorrhea, so many other issues. How do you actually not make people feel like they're singled out in the process? And if you want to integrate the entire process as a whole, as a community, then look at opportunities to do that, whether it's collaborating with hospitals, public sectors, looking at other education institutions, where we can actually integrate the concept of educating folks about menstrual hygiene. And towards the end, I would say that while we can be aware, we can sensitize people, actually the inclination to action something without procrastinating stuff, right, is super significant for all of us. So my dad would always say, if he speaks to a thyroid patient, before she's treated or on medication, and he asks her, are you feeling okay? She says, yeah, I'm absolutely fine. But it's only after the medication that she realizes that, she wasn't fine earlier. She's having a much better quality of life. So the quality of life index for each individual of us, right, at any problem, I think is very important for us to track as women.
Swati, I'm so glad that you brought out the quality of life, but also hinting at how do we nudge ourselves to engage in self-care. It's not just about treatment of disorders and serious issues, but also self-care. So thanks for bringing that, and we look forward to hearing more about Elda's offering. Sarah, over to you for your opening thoughts.
Yeah, thank you so much. And thank you to my fellow panelists for their incredible remarks. So I think, when I think about opportunities to integrate menstrual health with other sexual and reproductive health issues, Ben summed it up nicely. There's a surplus of opportunities here. And I think as many people have spoken about today, the menstrual cycle really is the start of the reproductive health life cycle. And so ensuring that menstruators have access to what they need throughout that life course is critical. And it's something that we need to more proactively engage with. I think two angles that I personally have seen and would like to call out. So the first, and Abhijit spoke to this a bit as well, is that the menstrual cycle often for people starts the conversation about sexual and reproductive health. And so when I used to lead menstrual health and hygiene trainings in some previous work that I did around the globe, in every single session that I led with people, somebody raised their hand to ask which days of the menstrual cycle were the safe days to have sex without conceiving. So an instant link and an instant interest in learning more about family planning and how having education and information about the menstrual cycle can facilitate family planning and decisions about family planning. I think, as a second question that I would often get is how using family planning could be used to manage menstruation. And Lucy spoke about this in her opening remarks about the linkages between family planning and contraceptive-induced menstrual changes and opportunities to explore family planning, not only as a way of making decisions about family size and the decision if, when, and whether to have children, but also about, intersections with things like menstrual disorders. I also think another opportunity is really meeting menstruators and particularly women and girls where they are. I think the fact that women and girls are often in this position of having to navigate such different systems across their life course is really difficult. So we have, a very private sector dominant sort of space for menstrual health. You have different clinics and facilities for family planning, and you have different clinics and facilities for maternal health, and they're all kind of built in these very complicated silos that are really difficult for people to navigate. And I think when we more intentionally try to create linkages across the life course, we not only empower people with knowledge and information about their bodies and the way that menstrual health might link to family planning or later to maternal health and later to menopause, but we're also making sure that consumers and that people who are participating in the menstrual health economy and in the reproductive health economy are able to get what they need where they are, and that it's not always, the onus is not always put on the consumer to go find that information, but that we're actively trying to provide that information and using those market dynamics to do that. And then I think the last opportunity that I would highlight is actually an opportunity I think that the menstrual health and hygiene space has to learn from the family planning space. And that's around the importance of choice, as well as the basket of options. And so making sure that we are drawing from conversations about the method mix and the way that we use different methods. I think we can take that information and apply that to the menstrual health space, recognizing that there's no single product that meets the needs of every menstruator, and then using opportunities to innovate and expand that basket of choices is critical. And I will hand it back over to you, Arundhati.
Thanks, Sarah. Powerful points on meeting menstruators where they are and on informed choice. Thanks for sharing that. Okay, so we're going to dig further in where we want to hear from each one of you about how your organization, the work that you are doing, is helping bring together or integrate menstrual health within health services, especially for sexual and reproductive health. So Abhijit, we're going to go back to you. So tell us more about how you're doing this through Japaigo's work, the Yash Entrepreneurs Program, and some of the other stuff, innovative stuff that you're leading.
Yeah. So like I said, Japaigo is committed to integrate in agreement with all the panelists and the earlier session. We think that menstrual hygiene and health is an integral part of sexual and reproductive health. And so everything that we do in this space, and last year, Japaigo took an intentional pivot to move away from verticals. And this is actually one of the challenges, so I should talk about this. Ecosystem in general, and by that I mean even us, all of us here and our organizations, the governments, the state, the nation, the policymakers, the donors, most of all, have a traditional habit of thinking vertically. So you throw an issue, and you suddenly get a department and a director and an assistant director and a team below it, and so on and so forth, and some funding attached to it. And that really sort of spoils the whole integrated argument. So we took an intentional pivot ourselves, and we said, we're not going to call ourselves an SRH team or an FP team anymore. We're going to call ourselves an SRH youth and gender team. And try to position ourselves as a horizontal rather than a vertical. And to say that, well, if you work with youth, you want to speak the language that we do. If you work in gender, you got to speak the language that we do, and so on. And in that light, we did a lot of work. So, for example, we have more than a dozen local partners who we are working on very innovative projects. Let me start with some part of the youth voice bit. So in Delhi with Restless Development, I see some guests from Restless here in the audience. With them, we have the Delhi Learning Lab, a physical safe space where young people can come together and act on their needs. Without us prompting, young people are doing action plans and social action projects on menstrual health, hygiene. They are accessing products. They are generating awareness in their communities. Some of our young champions who did a course with our partner ICRW on scientific writing are writing about the need to integrate menstrual hygiene. Our digital safe space, which you can visit on all the social media platforms, called Baatein Unlock, actually spawned a menstrual health collective on the side. There's a lot of traction in the conversation there. We also got, because we provide technical assistance to the school health and wellness. So this is about the government of India. So the government of India, we were in a very lucky position that we were providing technical assistance to the adolescent health division for the school health and wellness program. Recently, that division went to renew its curriculum for peer educators. We could contribute to the idea as well as the execution of adding a menstrual health module to the peer educator curriculum. Same with the school health and wellness modules, which has 12 modules, which are nationwide. We help the government add a menstrual health module to that. We have maybe the audience would know, but in last year, a PIL, a public interest litigation, reached the Supreme Court, and the Supreme Court asked the government of India to create a policy, a menstrual hygiene and health policy for India. Now, again, the symptoms of verticalization, that entire task fell on the adolescent health division. And it was only during the making of that policy that people realized this is a national policy for every Indian who menstruates. This is not only for adolescents. But still somehow the vertical, got set up below the adolescent health division. But still it enabled us to, provide support in making that policy. It's in the public domain, getting feedback right now from the public. But that's something that we incorporated. I have already talked about our Yes Entrepreneurs program and the startups that we support, where already we have actually a sizable number of startups in this space. Also, I mean, some people in the audience can, go to www.gotoudan.com. This is our aggregator for demand for young people, and you will see in the partners as well as in the product section, everything to do with menstrual hygiene and products. So while, I agree with Sarah, I put this in chat as well, that for us, it's integrated in whatever we do, whether it's something that we do with youth voice or action, whether it's something that we do with gender norms, or whether it's something that we do with actual health systems and healthcare delivery, whether through public or through private. And we continue to use menstrual hygiene as both an entry point, as a opportunity for innovation and scale, as well as an opportunity to close the loop and bring clients back. So apart from choice, what I must say, my frustration in this and what I haven't been able to integrate. Somehow, one of the problems of verticalization I've always talked about, but the other problem I face is, and this is a big challenge. So even our donors, we had to fight because they had a separate wing which had funds for menstrual hygiene, and a separate wing which has a fund for reproductive health, and a separate wing. And earlier I used to work for Gates Foundation. It's the same there. There's a separate strategy and budget for menstrual hygiene, and there's a separate strategy and budget. And so you really have to fight to say this is linked. But apart from that, another problem that I see in the ecosystem is this always thinking about the supply side. So the moment you think of markets and the moment you think of menstrual hygiene products or access to services, you think of supply. And we were lucky to talk to many state governments and support them in their programs on menstrual hygiene. And everywhere the problems were the same. Oh my God, we don't get tenders, we don't get the L1 bidder, the price is higher than what the government says, we buy, then it lies in our store. And I keep asking them, why do you buy? Why not just give an e-rupee voucher? So for those of you who don't know, e-rupee is a demand side voucher scheme by the government of India. And we said, why don't you just give a voucher and let the woman choose whatever she wants to choose from wherever she wants to buy it? And that would tell you what the market is doing, where are they buying, who is selling, what is being sold, what is the demand like, all of that. But somehow again, that's an inability, just like we don't think in matrices, we don't think, I think, from the supply side, away from the supply side. And so that's another challenge that we hope to overcome in the years to come. Over.
Thanks, Abhijit. That's some great inputs that you shared with us over there, and interesting to know about the e-rupee, and would be curious, perhaps in later conversations, to know how this is working out for SRH services as well as menstrual health. Navneet, we're going to go to you, and you've been looking at the femtech opportunity and femtech growth in India. So tell us about what femtech India is doing to catalyze this in the country. And we know that repeated products are one part of it, but we want you to speak more about what you're doing to address menstrual health related issues as well.
Right. So I think at Femtech India, our mission has always been to drive innovation forward, which means that we can reach out to more people, especially women, to spotlight the kind of work is happening, which you already mentioned, that we are building an ecosystem and female health technology. So especially highlight that part, how technology can be integrated to our life and how can we empower more women, which is, with through technology, and the work is happening in the space is also filling the education gap, which is mostly educating women about different menstrual health problems which were not ever discussed before, right? So we've also launched our, so there are, of course, there are two major problems I will highlight here when I talk about the ecosystem and overall opportunities and gaps. Is one is funding and the second is the research, right? So our mission has always been to work towards these two verticals, and we are also launching our first ever menstrual health, or I would say the kind of product landscape report on female health on India, which is one of the first of kind and the largest report, not just for tier 1 cities, but also understanding what are the gaps in tier 2, 3 cities, right? Because if we look at overall, only Spotlight and even femtech is very positioned in very niche way in India, right? But the opportunities are deeper down even more, and women don't even have access, or they don't have information. They're not even aware of the problems that exist. So we are trying to fill that gap, of course, supporting companies who are working toward mission. And I think our research will play a right role in terms of helping these companies what should be the right product market fit, which can also perhaps help companies to get funding. So because investors also been hesitate not to invest in this sector because there is not enough research. So we are building that white paper and the ground up work that which can help companies to build better product market fit, but also bringing global companies into the landscape that, whereas we know India's demographic power, India has a lot more to offer, but how can we bring in innovation from outside of India where they see as an opportunity, but we all of us working towards solving one mission, right? So I think to sum it up, like, of course, our goal has always been to drive the industry forward, education, awareness, support companies who are working in this space. And I think the most important, the research will definitely serve this gap, and that will eventually help companies to build better products. So if we are building better products, and as I said, the femtech companies are always focused more on education and awareness. So of course, we are empowering more women. So I think that will overall contribute, and we see bright future in coming years that this category will evolve. We will see more innovation in terms of product landscape, but we'll also see more women getting aware of lifestyle diseases, which can overall contribute to the growth and also make consumers more aware.
Thanks, Navneet. And we look forward to your report and also future thoughts on how we can take some of these femtech offerings, which are often focused on middle and high income groups, to India's very large and wide base of the pyramid. And on that note, Ben, your Ask Nivi platform is trying to bridge that gap. So tell us more about that.
Great. Glad to. I want to start with this story of integration and how we've, in some ways, worked ourselves into this, work backwards into integration by starting with some lessons we learned early. When we started Nivi, we launched Nivi in 2016. It was initially a very well-defined journey. It was one around contraceptive decision support, digital counseling. We took a popular job aid for counselors and flipped the script, as it were, and put the algorithm effectively into an interactive voice response, series of questions with prompts that we put in front of women to help them establish what methods were most appropriate and relevant to them. As a chatbot platform, that made sense. But what we added, just in case people had questions, was an SMS helpline on the side. People began messaging us a lot on that channel, on that SMS. They had questions related to contraceptive decision support that was not exactly about deciding on or identifying the most relevant method. We realized that was a core part of what our product ought to focus on. So we integrated conversation into what now is Nivi on WhatsApp. So we're a conversational chatbot. And we started with this focus on family planning. We've grown since. We went from Kenya into India in 2019, Nigeria in 2020. We now have served 1.5 million consumers, health information and education, provided digital support and counseling on selected topics, including contraception, and then also referral. We can refer into more than 15,000 points of care. In India, that means we've served over 900,000 users. We have roughly 8,000 providers that we can send users to. We've got users from across the country, so pan-India. We're relevant and available in 5 languages, in English, Hindi, Kannada, Marathi, and Assamese. So you can see there's some regionalization in our focus across the country. And we've moved from family planning to add maternal health. It's a standalone journey. It's up and running. We've got a partnership with the government of Assam, for instance, now onboarding over 170 public facilities in 3 districts, looking to engage more than 200,000 women on a maternal health journey that initiates certain questions and information initially during pregnancy, but then carries forward all the way through the postpartum period out to 15 weeks. That journey of discovery really is an ongoing process for us. And we're thinking about what we're doing now on family planning, on maternal health, on HPV, raising awareness around the vaccine, around the importance of cervical cancer screenings. And what we're doing on selected primary health topics of malaria, tuberculosis, and others is highly relevant to how we're approaching learning and integrating menstrual health into essentially the life course that we're able to support on the platform. What we're doing here with menstrual health is, we've begun just organically adding menstrual health information, not yet in India, but looking to do it, having done it now in Kenya, organically adding it and seeing where consumers are interested in the content, who's responding to it, and how are they bringing it in to their use of the Ask Nivi WhatsApp bot. I took, anticipating this call, a cross-section of our data from Kenya, where we do have menstrual health and family planning content up and running, and a cross-section of about 5 months. We've got 40,000 users in those two, in that time period on these 2 topics, family planning and menstrual health. The majority are coming in for family planning. They're responding to campaigns that we've set up and run with partnerships in place. But we did have about 25% of our users coming in curious and looking to understand more about menstrual health. And so I looked, how much overlap do we have between these 2 groups? There are those coming in exclusively for FP, others exclusively for menstrual health. But where we did have overlap, I began to see some interesting demographic patterns. One, the overlap was more pronounced in the younger age groups. We began seeing young people in particular coming in for FP or for menstrual health, and now exploring the other topic as well. And then as we get into older age groups, into the mid-30s and the high 30s, we're finding more people coming in exclusively interested in menstrual health, either for their children perhaps, or for themselves as they begin to experience or anticipate menstrual health changes into their 40s. So from this ability to launch organic content, we're able to develop insights. And so behind me, I know I'm not supposed to show slides, but I wanted to give you a sense of what that product flow looks like, where we started over here with a bit of behavior change, thinking about what that means for Nivi impact, but then from that, developing insights that could then lead into some innovative solutions to optimize that product market fit. So I'm a little over time, but I wanted to give you a sense of how organically you can learn from this process and look to loop or weave in menstrual health into both health journeys and product in these markets that we're looking to really energize for the first time.
Thanks, Ben. And I love that, we didn't allow you to have slides, but you managed to communicate this really powerfully with your background. That's great. A good point for several of us. So Swati, tell us more about how Elder Health, which is perhaps India's first and most prevalent platform for midlife and menopause. So it's great to see this highly neglected issue come forth with Elder Health. So tell us more.
Absolutely. I loved how Ben said late 30s are old people, but for our cohort, they are infants. So the average age, by the way, in India for menopause is around 46 years, which is way lower than the global average, which is around 51 years. So you can look at the landscape in India and see how women are not only hitting puberty earlier, but we're also hitting menopause much earlier compared to our global counterparts. I'll talk a little bit about menopause itself, and I'm assuming ELDA is synonymous to menopause, so I won't, talk more about the company, but the cause in itself. There are around 150 million women in India who are going through menopause. And while menopause comes with a myriad of its own symptoms, from hot flashes to more physical issues like bloating, to more sexual health issues like urinary incontinence and pain during sex, and mental health issues where you suddenly start crying, there's tearfulness, there's anger. So if you've ever wondered why your mother, who was always active, suddenly became so tired and groggy, it's menopause, her friendly or not so friendly phase. So I think broadly, this phase seems like a really large phase. And when we started digging deeper a few years ago, we realized it includes around 1/3 of a woman's life. So why shouldn't we do something in this space, right? And like Navneet had mentioned, it's a combination of products and services in the entire ecosystem. So when we started looking at it, we realized it is medical intervention. So ELDA found a gynec and a menopause specialist co-founder who had experience in treating, menopausal women. Then we found a product and tech co-founder who's built product at scale to millions. So it's only when you marry the medical or lifestyle interventions with technology is, we're able to penetrate into a space which is extremely ignored. So today we have around 100,000 women's data and inputs. They're all through our free programs. We also run some paid programs, and we've introduced our products, which is nutraceutical products specifically for menopausal issues. While I'd love for us or any other company, honestly, building in the menopause space to go and touch every life of that 150 million women, I think this is such an ignored topic that even today, after 3.5 years of building the business, when I speak to midlife women personally, they tell me they're not going through menopause because they're just 50. So unfortunately, the taboo of not being reproductive age is so high that you don't want to be in menopause and perimenopause because that feels like, hey, I'm not woman enough, right? So broadly, to conclude, what have we been doing at ELDA, and what I would urge every member of this session to sort of do, please spread awareness and education. If you see a 55-year-old man, he's your first target. Explain to him what his wife is going through or what his colleagues are going through. If you find a 15-year-old boy, just like my son, please explain to him that his mom is probably perimenopausal or menopausal. So I think awareness is super important. Providing care which is reasonable, accessible. In our case, we can only provide digital care, which is at no cost to our customers. For everything else, we have to charge because we are a small startup. So providing that access to their care is very important. And of course, the third thing is just inculcating that delight of life and telling a 45, 50-year-old woman that her life has just started and she's got another half of her life remaining. So I think just providing that positivity and explaining to her that she doesn't have to endure the pain is very important. So ELDA's mission has been, to ensure that women feel better during this phase. Just another anecdote, we have, I think, gone through the entire cycle from menarche to menopause. Interestingly, when we treat menopausal women, we have a lot of menarche issues also solved because a 50-year-old woman has a 15-year-old daughter at home. So it's a very interesting sort of an anecdote. And it always irks me why people only talk about reproductive health in the context of pregnancy or puberty, when menopause is a huge problem. So I think there's a lot more that could be done in this space. And I'm hoping that a lot of companies will now start building in areas around menopause. And also, disclaimer, Arundhati, I am perimenopausal, so I have a bias towards this space a lot.
I feel you, Swati. I feel you. I'm joining you in this journey. But Swati, I think that I appreciate that you've always brought in this, the quality of life perspective, and also how do we begin to view this positively despite the challenges that we're facing. Thanks for this. Sarah, over to you. Now, you've talked about that we can learn a lot when we look at what family planning has done, especially from the market shaping lens. So tell us about your insights and the work that you've seen happen well in other SRH spaces that we can draw upon for menstrual health.
Yeah, absolutely. Absolutely. So I think, one thing to maybe frame this conversation a little bit is that the menstrual health market is incredibly unique within the sexual and reproductive health market landscape, largely because of the way that it is so consumer driven and consumer centric. So when you think about family planning commodities, there's been tremendous investment by donors in order to subsidize the price of family planning commodities, to try to then scale those commodities up and create access at affordable prices. And they have, in some ways, they've seen incredible results. There's expanded access. It's scaled in a way that we wouldn't have seen without donor support. But the challenge of that is that it has come a little bit at the cost of some of the market dynamics. So there are some challenges now in transitioning some of those subsidies and subsidized markets to more of a total market approach that engages the private sector. Maternal health is also managed very differently. So maternal health commodities are by and large procured by governments. And so they are still, paid for by a different consumer or payer than the end user. Most of the time, there are certainly exceptions to that. And so the consumer is in some ways removed from the maternal health commodities in terms of the way that they are procured and paid for, as well as in the way that some decisions are made about their use. Those are typically made by an OBGYN or by a doctor rather than, the end user choosing which commodity or which product they would want to use. Menstrual health is unique in that it, to some of the previous points, has not received as much dedicated donor support from a subsidized perspective, and the market is much more fragmented. So there's not a centralized procurer that is procuring menstrual health products, and there's not a centralized sort of entity that is funding those products. And so that has created challenges in terms of scaling access, but it's also created some really incredible opportunities. And I want to kind of lean more into the opportunity angle. I'm sure we could discuss the challenges as well. But I think one of the opportunities there is that when you have a market that's mostly consumer driven, you are able to identify ways to make that market more sustainable while meeting the needs of the end user. And so in this case, the menstruating population. And I think one of the incredible opportunities here is using those market dynamics in an intentional and meaningful way to drive down the cost of products. And so respond kind of to the willingness to pay or the affordability angle for the end user, while also pushing for innovation and additional thinking around the types of new products that could enter the market, or improving upon current products that would better meet the ends of the end user, the needs of the end user. And so I think one of the things that's really promising to me about that particular approach is that by focusing on those market dynamics, we are creating opportunities for private sector partnership. We are creating opportunities for integration kind of across the value chain. So looking at everything from, manufacturers of raw materials, manufacturers of menstrual products themselves, different service delivery models, different integration opportunities with different sexual and reproductive health areas. And then really ensuring that the end user's needs are met by that market. And when you lean into those market dynamics, there is an incentive, a monetary profitable incentive for the market to respond to what the end user wants. And that's something that we don't always see in a space where commodities are being fully donated or fully funded by an external payer. I also think there's an incredible opportunity to use the market to create a more sustainable kind of long-term option for menstrual health products. I think one of the challenges we've seen in other commodity areas is how do we then kind of move back from donor-funded support and transition the funding for commodities to country governments or to subnational governments or to private sector payers. And that's something that's been a little bit tricky. And so I think menstrual health is in a really kind of great space to be able to more proactively plan for that long-term market sustainability and apply those lessons learned from family planning, from menstrual health, and from other health areas. And then I think sort of one last angle that I would flag here as well is that with the market dynamics and with some of the market shaping opportunities in menstrual health, I think there's also incredible opportunity to better engage partners and manufacturers in the global South. I think a lot of the challenges that we've seen in global markets for family planning and maternal health is that those commodities are still by and large produced either in Europe or in North America or in very specific manufacturing locations. They're then shipped out to different countries to meet the needs of different populations. And with menstrual health, there's a lot of really great work happening kind of more at the small and medium enterprise level of producing products locally. And I think that's also a really good opportunity for strengthening menstrual product supply chains. Because then, there isn't that reliance on shipments coming in from other locations. There is an opportunity to kind of innovate at the country level while still applying, globally agreed upon standards through the International Standards Organization and other quality kind of standards bodies. But I think that's another area that's a little bit unique for menstrual health that maybe we don't see for other health areas. And then finally, I think the last piece that I'll highlight is just menstrual health has an incredible way to engage the private sector in a way that other health areas sometimes have struggled to do. So I think, in a lot of conversations right now, there's this talk about private sector engagement and how do we better engage the private sector. And there's, I think, a little bit of work, and Arundhati, we've chatted about this a bit, but there's a little bit of work to do to demystify what that means. I think sometimes there's an assumption that the private sector, is only in it for the profit. And I think that if we can better shape the narrative around the role the private sector plays and the role that the private sector plays in accelerating access in a way that is meaningful and equitable, I think there's immense opportunity there. And I also think that there's a strong opportunity to leverage the private sector in a way that then frees up resources that are provided by the public sector. So the private sector can help make those markets more efficient, which can then help with the distribution and allocation of public sector resources to really meet the needs of populations that truly cannot afford these products. And so there's a little more there than just the profit side. It's that public-private partnership can free up resources in a way that streamlines and really focuses our efforts to scale access in places where it's needed most. And with that, Arundhati, I'll hand it back to you.
Great, thanks, Sarah. I really like the point that you made on that the menstrual health landscape is very consumer driven, and that's quite different from what we're seeing in some other SRHR issues. And that's a huge opportunity for us to leverage. And of course, on the private sector lens as well. Okay, so we're going to move to our last question, but we're going to make a small change. We're going to give you all just about less than a minute to respond. And our question to you is that if we want to build and strengthen this market-based approach to menstrual health, what's the one thing that you think you need to do so? So you as your organization or the kind of work that you're doing. So what's the one thing that you think you need support on or that needs to be done if we want to further build out the market-based approach to menstrual health? So Abhijit, we're circling back to you. Just under a minute.
Yeah, so like I said, I think the demand side of the market and especially for financing this market and to shape this market. So you all just talked about, the balance between how this market is much more consumer driven, much less donor driven. There are, of course, concerns of equity of those who can't pay for these products. And so the third party payment from the government is required and so on. But all that can be done if we think, all of us together think constructively about demand side financing in this market. Too long has financing been dependent from, either private or philanthropic funds. I think a mixture of these blended financing instruments, especially on the demand side, would really help. Over.
Thanks, Abhijit. Let's go to Navneet. What's the one thing that you think that needs to be done, Navneet?
Yeah, I think I totally agree with Abhijit that, I would say like we all of us trying to do all the great work, but I believe we need more participation of people coming together and collaborating and, constantly working towards advocacy awareness. But I would say research and funding, because then we can support people, organization can do better work if they have more funds. So I think I'll sum it up here that to kind of build that ecosystem, the funding is very crucial. And how do we do that collectively, working together, bringing our area of expertise, but also mutually collaborating that, what all we can contribute and really filling those gaps. And I think, end of the day, it's one common shared goal. And I think to drive that forward, to make it a bigger impact, of course, the money plays a huge role. And I think that's also kind of missing right now even. So I'm building ecosystem. I'll talk about overall landscape, but also the founders who are building in this space, that how they can also go to tier 2, 3 cities. The one thing I will add on here, because right now the infrastructure does not support tier 2, 3 cities. So for example, women who are living there, they actually depended on local pharmaceutical products, if we talk about products, right? But they do have capacity to pay, but they don't have, so there are not resources who are reaching to those small towns, right? So I think if we can build infrastructure better way, build distribution channels in better way, that what we're trying to do in tier 1 cities, we can also kind of do it in tier 2, 3 cities. As I said, all these companies have a core mission, education and awareness. So we are not just selling product, we're also equally contributing into creating awareness, educating women. And I think which is really, really important to fill kind of all that gaps. And again, bring that will also drive the industry forward, but also build product for what Indian consumers want, right?
Thanks, Navneet. And also this kind of focus of moving from tier 1 to looking at these underserved areas, but which are a very significant part of the base of the pyramid. Thanks. Ben, over to you. Your one big thing.
The webinar today, the webinar that was done previously, the focus here in RHSC is around market shaping. It's about expanding opportunity. And with that, it's in some ways a green field. You know, there's an opportunity to expand into areas that have not previously been served, reach consumer segments that have not previously been reached. When you do that, there's an element of risk. So when we talk about financing, we need to talk hand in hand about the role of information to de-risk that. I think Naveed's comments earlier about the importance of research. Another way to think about research or insights or market information. And by providing that regular real-time information about what specific consumers are doing, what they're not doing, and why they are or why they are not doing what they're doing, can go a long way toward better product market fit, whether it's introducing new products or repositioning existing products to better reach new consumer segments. We need information to lubricate that process, to make it easy as we grow, make it easier anyway. It's never going to be simple, but make it possible to reach additional consumers. So I think it's just helpful, and it's been helpful for me actually to hear you all say this as well, but the market shaping component is really critical, and the role of de-risking that whole process with information.
Thanks, Ben. I have comments on that, but I'll come back to it. Swati, over to you.
Yeah, the advantage of being last but one when you just have 1 minute is the panel has already covered all the answers, but I'll still give my 1 point. So definitely finance and research, super important in this space. But I would say if there's one thing that's needed, it is patience and lack of patience. I think patience from the investors' side or the people who are funding, these projects, because this is not, excuse me, but not cryptocurrency or something else where you put some money and then, suddenly you see things happening. It's healthcare, it's menstrual hygiene. It's going to take years, if not decades or centuries, right? So patience, lack of patience from the consumer side, saying, I'm not going to endure this pain. I want a great solution to ensure that I have a great life going ahead. So my 1 point would be patience, Arundhati. And depending on which
and lack of patience,
your choose. Yeah.
Thanks. Sarah.
Yeah, thank you. So this answer in some ways might be a little bit of a cop-out, but I mean, I think what we need the most is more data, but across different segments of the market. So I think better understanding what drives the price of menstrual products would be incredibly helpful. It would help us target interventions and policies that could then reduce the price and meet the needs of the end consumer. I think better consumer insights would be helpful. So really understanding, what is working for consumers, both in terms of the product itself and the services that they receive and the information that they receive, but then also how much they are willing and able to pay for those products and services and information. And then just more data and insights about kind of where products are, how they move, and sort of how they move across borders, how they move internally in different countries. I think all of that type of data would help us better optimize market dynamics between the supply side and the demand side. And I'll hand it back to you, Arundhati.
Great. Thanks so much, Sarah. So we've got a last call for anyone who has any questions for our speakers. But we're going to move towards wrapping up. I think, Abhijit, we have one question for you. Is on your point of choice, do we need more operational research to be able to influence the traditional funding structures that we have? And are you able to generate any such data through the ongoing partnerships?
Yeah, so the choice point that I made was more in terms of the product. Most healthcare dialogues become very quickly very prescription driven, and we very quickly start saying what's best for what age group, what's best for what socioeconomic group, what's best for what ecosystem, and so on. And I think family planning programming over the last 3 or 4 decades has taught that that's a slippery slope we need to avoid. So that was more in terms of the choice part. In terms of the operational research, I still think that universal coverage for menstrual health and hygiene will not be possible if we continue to only look at either public or private, either digital or physical, either consumer out-of-pocket financing versus third-party financing. I think a blurring of lines and a blending of these concepts will be essential if we are to universalize access to menstrual hygiene and health.
I think that's exactly what we think that the market-based approach or the market lens can bring to this. So with this, we're going to wrap up this panel. A big thank you to Navneet, to Swati, to Abhijit, to Ben, and to Sarah. But I'm also going to hand over to Sarah for some quick kind of wrapping up reflections from her. And how does this webinar, the insights that you've heard today, Sarah, link up with RHSC's broader work that's happening on building the market lens for menstrual health and beyond?
Yeah, thank you, Arundhati. That's a great question. So I think one thing that I want to start by saying first is a tremendous thank you to our co-hosts, Arundhati and Tanya, but also to all of our panelists today. As you can see, there's no shortage of ways that we can integrate menstrual health more broadly within the sexual and reproductive health ecosystem. And there's also so many different considerations for how we can better support menstrual health markets. And I think that we are really only scratching the surface in this conversation. And so we would certainly like to continue that conversation. That's something that we're hoping that this work at RHSC will continue to play. And so I think, when you think about RHSC and in particular, this particular scope of work with the Menstrual Health Supplies Workstream and this ongoing collaboration with our Market Development Approaches Working Group, there's several different ways that we kind of see this moving forward and invite all of you to participate in. And so I think the first opportunity for really supporting this is convening global and regional conversations like this one. I think for those of you who are not familiar with RHSC, one of our main ways of working is bringing people together, facilitating conversations that really cut across different sectors and different stakeholder groups, and trying to find ways that we can all better leverage the work that one another is doing to learn, to apply lessons learned, and then to really drive forward some of the best recommendations that we have from these groups of people and from these conversations. I think the second opportunity is engaging traditional sexual and reproductive health and also menstrual health and maternal and child health players, and expanding the scope of their work to really strengthen the way that they support menstrual health. So looking at opportunities to integrate menstrual health into donor-funded activities that are happening, looking at opportunities to engage donors in de-risking some of that market shaping and investment that would optimize menstrual health markets, looking at engaging the private sector, bringing together manufacturers, bringing together advocates, bringing together civil society, and finding ways that we can expand the work that traditional sexual and reproductive health players are currently doing to better encapsulate menstrual health and respond to the needs of menstruators. I think the third opportunity that RHSC takes on and that we certainly invite all of our stakeholders to participate in is with regards to generating and disseminating evidence. I think, as I just said in my previous remarks, there is a little bit of a shortage of data in the menstrual health space. And RHSC has been playing an active role through things like our LEAP report, as well as through other kind of market analyses and publications to look at some of that data. But there's always the need for more data. And so while we continue to sort of aggregate and analyze and make recommendations based off of the data that we have, we would also call to action all of our partners, our members, and all of you on the line to continue to identify ways to improve that data, both in terms of the quantity of data, but also the quality of data and the insights that we're getting. And then finally, and I think this speaks a bit to what Ben said, as well as what Arundhati said in setting up these closing remarks. RHSC has played a tremendous role in market shaping within sexual and reproductive health supplies globally. And so being able to then flex that expertise and bring together members that have been very active in that market shaping work to apply those lessons learned to the menstrual health space is something that we're really excited about. And so our Menstrual Health Supplies Workstream has been very active this year with this joint learning series with the Market Development Approaches Working Group. There's several different spin-off conversations happening within that scope of work to really dig into some of the details here. how do we take those consumer insights and apply them upstream to better inform some of the decisions that are being made? How do we collect information about what's driving cost, and how do we get better insight into how products are moving across borders? And so this is something that we will continue throughout the year. I'm going to put a link in the chat to RHSC's Menstrual Health Supplies Workstream, but we do look forward to continuing this conversation in our joint learning series. If you subscribe to the Workstream there, you will get the emails kind of as these webinar series are announced. But yeah, we'll just leave everyone with kind of a closing thought about how this might fit in your work, and then different ways that we can continue to share lessons learned to come together and really optimize markets, not just for the profit side, but to make sure that products are getting to people who need them in a way that's affordable, that's equitable, and that maintains quality. So thank you all so much for being here today. A huge thank you to you, Arundhati, as well as to Tanya with Menstrual Health Action for Impact, our co-host, and to all of our panelists. Thank you for a great discussion. And with that, we will look forward to engaging following the webinar. We'll send out the recording and all of the resources shared today, and hope that you all have a great rest of your day or evening, wherever you are in the world. So thank you for joining.